Parkway's perspective. As growth continued, Parkway's leadership remained committed to providing dignity and health to all residents in its facilities. The board of directors states that they wanted to see a renewed commitment to this firm's mission and core values, not a diffusion of the culture. This leads one to infer that the board of directors believes there is a problem within the company. The following slides discuss interviews that resulted from the concerns of the top management. Employee comments. Shift leader Maxine Vernon, who has been with Parkway for 15 years, says that the government influences the management of Parkway to keep staffing levels up. This has caused management to make poor hires in order to keep the positions filled, thus negatively affecting the overall care of the patients. Nurse Bobby Reed believes the problem is not with the staff, but one with the company. Parkway is too focused on keeping the beds full. She also stated that originally, when she began working here, Parkway had a reputation of service, but now it is just about the numbers. With too many patients, there is too much room for unintentional negligence. Employee comments continued. A recent college graduate, Dalton Manatee, said that the job is more stressful than he thought it would be. The patients are always complaining and constantly making demands. He expresses that he spends most of his time logging complaints, which lead to nothing, just to please the government. Carmen Frank, a fairly new employee, expresses how physically demanding the job is. She has been unable to meet the demands of her work on a daily basis and is constantly falling behind. She is already looking for another job. Human resource information. In order to strategically plan, the board of directors wanted to view statistics of the company relating to the care of the patients and employees. The basis of the results fell into categories such as the year, number of patients, injuries per staff member, incidents per patient, certified absence per staff, other absence per staff, and turnover rate. Injuries to staff occur mostly because of the back strain from lifting patients. Patient incidents reflect injuries due to slips, falls, medication errors, or other accidents. Certified absences are days off from work due to medically verified injuries or illness. Other absences are excused but are not medically verified. Results. From the year 2000 to 2009, there was an increase in patients by 4,100 people. In that same amount of time, injuries per staff member increased by 110%. Incidents per patient nearly doubled, and absences certified and other increased at a steady rate higher than that of the growth of the patients. Lastly, the turnover rate increased by 4%. These quantitative numbers support the concerns of the staff and prove that there is a problem within the company.